Welcome to this seminar on Europe's next healthcare frontier. My name is Britta Stensson. I work for Business Sweden, and with me here in the studio, I have Michaela.
Hi, Michaela Anneling Svan from Swecare Foundation. I'm a regional director there, and at Swecare, we collaborate with Business Sweden a lot. So, pleasure to be here.
And for those of you who don't know, Business Sweden is the Trade and Invest Council of Sweden. We have two main functions. One is to help Swedish companies grow globally, and the other is to attract foreign investments into Sweden. And we do this mostly through our foreign offices. We have 45 offices across markets that are important to Swedish companies, and we are very happy today to have 3 of those offices from Europe here, not in the studio, but on link. So we'll be talking today about Italy and France and Spain. We also have 2 great Swedish companies that will share their internationalization journey. With us, we have Dokla and Prostate Genomics. So we're really looking forward to this webinar.
Yeah, but to kick off, Europe is on the agenda. Britta, what would you say are some of the key trends in Europe in the healthcare sector?
So I'd say that the key trends are these trends that we've seen for a number of years. The changed demographics, of course. We have an aging population, which is mostly due to people actually surviving diseases that they died from previously. So it's a good development. Yes. But it does mean a challenge to the healthcare systems and the care systems in Europe and in the world. We also have staffing shortages. When you talk to people about sort of what's going on in the healthcare system and the healthcare systems globally and in Europe today, a lot of discussions are about how we should actually staff our hospitals and our care units in the future. There's discussions on physician burnout, on nurses burnout, and I think the pandemic also pushed this even further. The digitalization is, of course, has a huge impact on society in general and on the healthcare systems. And also AI. There's been a lot of discussions on AI in healthcare. We'll see where the development takes us, but it's a really interesting space, obviously. But I think that it's important to remember that even though we have these global trends, the local healthcare systems are very different, and they are still the regional or they're local or they're national. And I think that's why it's so good that we have our national representatives with us here today that will give detail on what's actually going on in Spain and France and Italy. Because even though the trends are global, healthcare systems are still quite different, and they're quite national and regional.
Everyone wants to be unique, right?
But Michaela, so now that we're talking about the EU and Europe in general, so Sweden is just finishing up our EU presidency. A lot of people keep asking, like, what have we actually done during the presidency? Has there been any movements? What has been the big trends? Could you elaborate a little bit on that?
Sure. So it's really the very end. It actually ends on June 30th. So some of the topics that have been high on the agenda is the European health data space, regulating the digital healthcare companies, and will play a major impact on the companies in that field. We also have the European Beating Cancer Plan that's been high on the agenda. The new pharmaceutical legislation has caused a lot of debate and frustration, how Sweden and Europe can actually stay competitive. But on the EU agenda, it's a little bit of a diplomatic case. Sweden has to stay neutral during the presidency. We also seen in the field of AMR, the One Health Action Plan on antimicrobial resistance, with some clear agenda setting strategies for each of the countries to set targets so they can actually deliver on that. But that's just an overview, and the summary of all the thousands of meetings that have been taking place have not been done yet, because it's still a few days to go. But we're happily discuss that further in another seminar.
Yeah, and there is one more life science related event before the presidency ends.
Yes.
Next week there will be a big life science precision medicine seminar at Karolinska Institute here in Stockholm. So that will also be interesting to follow.
Yes, for sure.
Okay, but let's get on with the actual program. So first off, we have Italy. We have my colleague Maria Dahlberg with us. and she's a senior project manager at our office in Milan. Could you just start by giving an introduction to the healthcare system in Italy? How is it different from Sweden, and what are the main things to know about the Italian healthcare system?
Absolutely. Well, I'm really happy to be here. So thank you very much. I'm happy to share more about the Italian market. And I would begin by saying that Italy is in a very attractive market for Swedish healthcare companies. There's a large population, 60 million people. It is a welfare state, and it has a very advanced national public healthcare system with many big investments on the way. And the national health spending in Italy is in line with the OECD countries in general. It has been increasing in the past years, but historically it has actually been lower than other EU countries. But this has been improving in the past 5 years or so, mainly actually driven by private spending that has increased. And the Italian healthcare system is actually quite similar to the Swedish one in the sense that there's central planning, but then quite a fragmented system with the 20 regions that have a high degree of autonomy. So the national healthcare, the Ministry for Health allocates funds to regions, and then the regions, they allocate those funds to local health authorities based on the number of patients in that area. And the healthcare system in Italy provides universal healthcare, which is free of charge, mainly free of charge at the point of delivery for patients. So also this is quite similar to the Swedish system. The national healthcare system is backed by an extensive network of private clinics and private healthcare providers to support the demand in Italy, even though the majority of spending is public spending. So about 75% of all the spending is public. The rest, around 23%, is out of pocket from households, and then the rest from insurances. But there's a very strong link between private and public spending and the sectors in Italy, because much of the work that the private sector does is to support the public healthcare system. I want to give you some facts as well about the population in Italy, because it's quite a unique case. 64% of the population is aged between 15 and 64 years, and 24% of the population is older than 65 years. This means that it is the oldest country in Europe in terms of a percentage of people over 65 years. And it is also the second oldest country in the world after Japan. This, of course, offers quite a few challenges, but it also means that the healthcare sector is focusing a lot on elderly care and to ensure that people have quality of life also in their later years. And this goes hand in hand with a lot of developments that we see within senior housing, for instance, but also medicines, medical equipment that are aimed towards the elderly. Also relevant for the Italian healthcare sector is the pharmaceutical sector, which is a leading industry in Italy, but also in Europe in terms of productiveness, competitiveness, and also spending in R&D. There are some 700 companies active in this sector in Italy, and the majority of the companies, 6 out of 10, are based in the northern parts of Italy, where a whole 35% are located in Lombardy, where Milan is also located. So it's definitely a cluster, very important area for pharma. And the total value of production in 2021 in Italy within the pharma sector was about 32 billion euros, and R&D spending was 1.65 billion euros. So very big numbers compared to the average of other EU countries. It is the public healthcare system that is mainly responsible for the funding of the pharma sector in Italy. National public sector funds 70% of the pharma sector, and it represents about 17% of the total healthcare spending in Italy. Yeah, this was a brief introduction to the healthcare system in Italy.
All right, thank you, Maria. We should also let all our listeners know that there will be a Q&A in the end, so please provide us with your questions already now.
We already have a few questions, actually, so at least some of the viewers did find the chat. But please keep adding your questions, and then we'll do a Q&A towards the end.
That's great. And Maria, what would you say are some of the key trends and developments in Italy?
Definitely say that it's similar to what Britta said in the beginning. We see in other countries, we also see in Italy, of course, but a lot is related to the digitalization of the healthcare sector, but also a lot of investments that are coming up to modernize hospitals, make them more digital, more technically advanced, but also more sustainable. Sustainable hospitals is a really hot topic right now in Italy. And the main challenges that Italy needs to resolve in the near coming future is definitely related to the population, what I mentioned before, an aging population, so a bigger part of the population that needs to be cured, but with limited resources, as well as limited space in hospitals. During the COVID-19 pandemic, this became quite clear, so it needs to be optimized in terms of the space that is available. And another last challenge is also regards to providing the same level of care in the whole country. Italy is quite a big country with many rural and far off areas, and it is a challenge to ensure same level of care in the whole country. So in order to handle these challenges, there are quite a few investments happening in Italy, and a lot of this money comes from the EU. More in detail, it comes from the Next Generation EU Investment Funds, which is a funding scheme from the EU that came after the COVID pandemic, and the idea is to relaunch the economies after the pandemic. So countries in the EU could create plans for how they would spend money in order to relaunch the economies, and based on these plans, ask for funding. Italy wrote a plan and is the country that will receive the most funding in all of the EU, some 200 billion euros to be spent before 2026. In Italy's plan, out of these 200 billion, about 16 billion euros is aimed for the healthcare sector. And a lot of these investments are aimed towards the digitalization of the healthcare sector, a lot within telemedicine, telemonitoring, for instance. So we believe that Swedish companies here have a specific competence that can be of use for Italy to realize these plans. The investment plan for the EU funding is it consists of two main components. The first component is worth 7 billion euros and is called Proximity Networks, Structures and Telemedicine for Territorial Assistance. And here it's all about actually constructing also new health clinics in order to come closer to the patients out in the vast territory. But it is also a lot about telemedicine and financing telemedicine projects that regions can propose, but based on priorities of the Ministry of Health. And these projects, they can cover any actually area of prevention and treatment and be within tele-reporting, teleconsulting, consultations, telemonitoring, teleassistance, so many different areas. In this component, there's also an objective to activate 600 territorial operational centers, as they are called, and this serves to ensure that there is interaction and an interface between the home care, so the telemedicine, and the hospitals and the emergency network. The second component of the investment plan has 8.63 billion euros in funding, and it's called Innovation, Research and Digitalization in the National Healthcare System. So here it's really all about updating and modernizing the healthcare system, mainly aimed towards hospitals, making sure that the technology part within hospitals is upgraded to become more modern, more digital, and more sustainable. There are some 280 health facilities that will receive funding and will upgrade their technology. And for instance, 3,000 pieces of equipment will be purchased that have a high technological content. So these are some quite big tenders and important tenders also here for Swedish companies. Lastly, I just wanted to give a little update on what's going on within telemedicine in Italy. It's still quite a fragmented area, but there has been some we're going towards a more structured way of dealing with it. But so in 2018, the Ministry of Health did a survey to understand what is going on out in the country within telemedicine. And there were around 300 active projects ongoing within telemedicine. At that time, they were within teleconsulting, telereporting, telemonitoring, mainly within cardiology and radiology, and both aimed towards chronic and emergency care. But the use of telemedicine has, of course, increased in the past few years, mainly driven by the COVID-19 pandemic, but of course also now the EU investments, but also because the National Institute for Health in Italy has recently created the legal definitions of all the areas within telemedicine. So this now opens up for a more structured ways of using telemedicine in the national healthcare system. And just lastly, regarding reimbursement and telemedicine, there is no official code that gives a specific reimbursement within telemedicine at the moment in Italy. It is reimbursed as a normal visit, but there are some exceptions and limitations depending on the specialty involved and the type of visit that it is. Yes, this was all from Italy for now.
Wow. Thank you so much, Maria. I'm sure there will be plenty of questions, but we decided to keep the questions in the end of the presentation.
But I think it's really interesting to hear both on the telemedicine and on the sustainability aspects. And also, I didn't know that Italy had the second oldest population in Europe.
Me neither.
We learned something.
We're learning
really
new
good
things.
So let's move on from Italy to France.
Yes.
We have our colleague Emma Hemmingsson, who's also a senior project manager at our office in Paris. Emma, welcome. Would you like to start with giving an introduction of the French healthcare system?
Absolutely. Thank you so much for having me. It's always a pleasure to talk about France with Swedish companies and Swedish audience. Just some context to start. So we know where we are on the map, basically. So France is the 6th largest global economy with its 67 plus million inhabitants. And France actually has one of the highest fertility rates in Europe, which is as contrast to Italy. It's a country who has generally recognized good healthcare system and with very high levels of health expenditure, reaching almost 12% of GDP. It's also a top 3 spender/investor in the OECD when it comes to healthcare. So it's important to note. It's also a country that's very centralized in many ways. Much of the power in most areas is still quite concentrated to Paris, of course, with exceptions, but I'm giving you a generalized view. And this is also something that you can see in the healthcare system. So the healthcare system is, as compared to Italy again, not regional or compared to Sweden for that matter. It's highly centralized with regional coordination by regional health authorities that are, in my interpretation, that should be said, basically regional antennas of the ministry that are responsible for coordinating and providing care in the regions. But it's very important to note that there's a high level of centralization in the system. It's a system that is based on a universal social healthcare, health insurance system, where basically everyone is entitled to basic healthcare services. It's seen as one of the most comprehensive systems in the world, since it covers everyone, regardless of income level, etc. In addition to this coverage, nearly the entire population, about 95% plus, has a complementary health insurance. And this is used mainly to cover co-payments and sometimes also, of course, to attain better coverage of things that are not necessarily covered by the general system, such as dental and glasses and so on. And it's an important point to mention because it explains a bit how the system works, but it's mandatory for an employer to offer this type of insurance to their employees. And normally the employer covers half of the premium. So this makes sure that most of the population is covered also by this complementary insurance. It means, I mean, this it's a complementary insurance means that also privately provided care is covered. And it also means something that's very important, that France has a very low out-of-pocket spending. So the French are not accustomed to paying for care nor for medicine at the pharmacy. So like I mentioned, the French healthcare system covers both the public and the private hospitals and private care, but both of these types are state approved in general, and both of them operate under the public healthcare system. So even though only about 30% of the healthcare in France is owned and provided by public actors, and the rest by private, this does not mean that these systems are separated. So private hospitals can be both profit and non-profit, and private hospitals will also have a bit more autonomy and quicker processes to adapt new technologies and methods and so on. But that's it's still really important to remember that the systems are very intertwined, and I mean, the private actors are channeling a lot of the public care. When it comes to primary care, it's provided mainly by self-employed GPs who are operating alone in individual clinics. There is a movement, or there have been ambitions to go to a more center-based form of primary care, like the work we have in Sweden, for example, but that's not really happening yet. We don't see that. There are, though, ambitions to do that, a lot related to cutting spending, of course. So the reimbursement rate that the patient is entitled to depends on the fact that the patient follows their own, or they respect the care pathway, and they start by going to their own assigned GP. That's something that's quite important, because that's also something that's problematic at the moment in France, because not everyone has one. Not everyone lives close to one. So we'll get back to that. That said, accessibility to primary care and care in general in urban areas is high. It's quick to get an appointment if you live in an urban area. If you don't, the question is a bit different. And the system is experiencing structural challenges with staff shortages, like you mentioned, Britta. That's relevant for the rest of Europe, but we also have the problems of medical deserts, overwhelmed emergency rooms, etc. And these are currently being addressed, to an extent at least, by quite massive investment and reform packages.
Great. Thank you very much, Emma. Impressive presentations from both countries, and we do see some similarities. But then can you maybe elaborate on the trends and developments? We know that you mentioned that people living in rural areas don't have a assigned GP. Does digitalization facilitate in that? Or yeah, please.
Well, hopefully it will soon. Mm-hmm. So I think I'll start just by, because I mentioned the investment packages. So I'll start there. So France is, like I said, France is investing heavily in the sector, especially since the pandemic. There was an announcement of a massive package in 2021 of 19 billion euros, which is basically dedicated to the reform of the system and the transformation of the healthcare system. 2 billion of these are dedicated to the digital transformation of healthcare. There's a lot that's happened in that area since then. There's another public investment program that's launched that's called Health Innovation 2030, which has 7.5 billion euro invested in basically the vision to make France a European leader in research and innovation. So the focus here is more on promoting biomedical research, the development of biotherapies, 5P medicine, and so on. And it aims to support and transform the ecosystem and enable quicker access to innovation for patients, which has been process that's been slow in the past, or that still is, of course, to some extent. And one of the early results of these investments and reforms is that France is actually, as of July 1st, so very soon, becoming one of the first countries in the European Union, and I think in the world, to reimburse remote medical monitoring solutions under its national health insurance system. So in other words, there's a French adapted version of the German DIGA. This applies to medical monitoring solutions and also actually other type of digital therapeutics solutions. But the monitoring ones are the ones that are being lifted, mostly in the communications. And basically it's focused on solutions that provide a clinical benefit or improve the organization of care, which is one of the main challenges here. And the idea is to enable rapid access for patients to digital health solutions at a temporary reimbursement rate for 1 year before, hopefully, a permanent listing. So getting information out quicker. There is currently a national pilot doing this, but it only covers 5 pathologies. So what's happening now is that this is being included in the general program, and it's being rolled out for all pathologies. And one main difference, I should say, with DIGA is that it is open to all classes of devices, so also the higher risk classes. So I like talking about this because I know that in Sweden, France is not necessarily in the past considered a pioneer in digital health. But the fact that they are embracing this model now, and of course with some adaptations and maybe some bolder adaptations, means that it's actually a step ahead of other countries. So it's been a very eventful few years for digital care in France. There's also the telemedicine and video consultation or video visit aspect of it that was basically zero before COVID, experienced a similar development as other countries during COVID, and now and for a period it was actually better reimbursed than regular visits. So and that there's a lot happening in that area as well. I'd be happy to get into that more in detail in other discussions, but there's a lot to say. So bottom line, basically, healthcare is really considered a national strategic priority in France, and we can really see a big shift in the openness and the digitalization and so on in France, and things are moving really fast now.
Great to hear. Thank you. And I know that there's a lot of interest from Swedish companies in the French version of the DIGA. So hopefully we'll see a lot of Swedish companies in that entering that reimbursement system now that it's open and becoming more and more available. Thank you. Very interesting and a lot of information in there. Very, very nice. So let's move on to talk. Now we want to talk to one of the companies that have actually done this journey. So we have, do we have? I think we have Dag Larsson with us, who is the co-founder and CEO of Dokla. That will give us an introduction to their company. Oh, there you are. Great. So, yes. Dag, would you like to tell us a little bit, do like the elevator pitch version of Dokla? Who are you? What are you? Why did you fund this company? What do you do?
Absolutely. So Dokla exists for one reason only. Hi, by the way, I'm Dag Larsson, CEO and co-founder. And we exist to keep patients out of hospitals and the care continuum. So for chronic care for years to prevent exacerbations of COPD or congestive heart failure. And we also work extensively around an acute episode. So we pick up patients that otherwise would have been admitted to the hospital, or we discharge them earlier. It could be perioperative, or it could be that they've had COVID or a pulmonary event, etc. We were started because my co-founder Martin experienced a heart attack about 6 years ago and went from that feeling of being in the hospital. You're very monitored, and then when you leave the hospital, you have nothing, right? So it's a very personal experience that kind of founded the company. And we've been extremely lucky with timing. The pandemic wasn't bad for remote patient monitoring in general, and also there's been a big central push in our large market, the UK. But we've also been quite contrarian in our approach. So we provide three things to the healthcare system here in the UK. First, it's a piece of software, which is an IoT platform that connects with all kinds of different gadgets, but also connects back into the electronic healthcare record. Secondly, we're like a medical Amazon Prime or Deliveroo. So we ship logistics, or we ship the devices to the patient's home with pre-configured mobile phones. We have customer service agents that call them. So in a sense, we sell compliant patients, not a piece of software. And we were really the paragons of this in the UK. And then finally, we've seen that a lot of our trusts, a lot of the NHS bodies we work with have had problems taking their frontline staff from the wards and putting them in front of a laptop to monitor patients. So we're also a caregiver, and we can refer patients into us directly. We've been around for about 4 years, and are now investing heavily in setting up presence in Germany, France, and hopefully a few other markets.
Great. Thank you, Doug. Thank you, Doug. That was very nice.
You want me to elaborate?
Yes, can you please...
Yeah, go.
Sorry. Can you please tell us a little bit about your internalization journey and the support you received throughout that?
Absolutely. So I think there are two ways of going into a new market. You can either do this, big McKinsey study and spend millions on market sizing and working on the exact proposition that you're going to have, etc. Or you can try to go out and sell and then see what works. And we are very much in favor of the latter. So we worked very closely with Business Sweden to basically generate leads and then starting having conversations with leading hospitals and different systems in continental Europe. And I think Business Sweden has been formidable in setting these meetings up, especially without us having boots on the ground. And God knows my Spanish isn't what it should be after having spent lots of time in. So if we have a meeting in Madrid, Business Sweden often have set that lead up and can then also help us with the translation, etc. So we very much work together with Business Sweden to generate interest. And then you guys also help us with setting up the initial conversations. And and for instance, in Germany, we've seen a lot of traction. Then we actually bring in a general manager, we take the capital investments, etc. So that's kind of how we're thinking around internationalization.
Great. Thank you. So how did you decide which market to go to first? I mean, there is for you, I love that you said you're delivering compliant patients. That sounds like a dream come true, I think, both to healthcare systems and to pharmaceutical companies and medtech companies.
True.
So how did you decide which market to go to? The world is such a big place.
Well, I think it's fairly opportunistic in the sense that we're looking at the large European markets, and there's only a few of them. And then again, we try to sell, right? So it doesn't cost a lot to translate your website to the local language. It doesn't cost a lot to set up lead generation and maybe work with a local partner or indeed with Business Sweden. And then only if we see that we get traction, that there's maybe a reimbursement system that's kicking in, there's central money that's kicking in, and there's actual payers, then we go in heavily and invest what was quite several millions into a market to support it, right? But I think it's one thing. It's true that these things takes time. It takes a lot of time to sell into to healthcare systems and to pharma. So I think a lot of the things that you need to prepare to actually go live, etc., you can do while you're selling. So we have this kind of revenue first, so this partner first approach, and again, Business Sweden has been a formidable partner there.
Thank you. So what makes your company unique compared to other companies?
So most companies in the remote patient monitoring space, they provide a software. That's typically, and it often ends there in the sense. And we are building a virtual hospital. So the rails, the software, the operations, the logistics, customer service, and also a critical amount of advanced nursing practitioners or advanced nursing, different specialities of doctors that you can escalate is very, very different from from what's out there in Europe. Definitely, there's a few players like us in the US, but nothing substantial in Europe. And that means that we operate remote patient monitoring at scale from the get-go. And that means that we're a very good option versus for a hospital system to build all of this stuff in-house. And we work across any type of pathology. And this is a very fast moving space. So if a large system partners with us, instead of, again, trying to do everything themselves, they get these injections of innovations constantly, and they get to start operating at scale from the get-go. It's also a very kind of difficult company to build because you're being regulated from so many different perspectives. We're being regulated as a medical device company. We're being regulated as a caregiver. And we're working in several different markets where the regulations are fragmented. So I think we like to go into markets when we have traction. And if you could doing all of this like proactively, it would be prohibitively expensive.
Thank you. Then it sounds like compliance is very much an issue. But with that said, where do you see yourself in the next 5 years?
So I do believe that in the next 5 years, we will have built Europe's leading virtual hospital. So we'll work together, both white labeling, but also under our name, Dokla, to be able to refer large chunks of chronic care patients and prevent unnecessary suffering from unnecessary exacerbations, and also lowering spend in secondary care by making that investment in primary care, if you will. We'll also have changed the model in and around the hospital of not admitting everyone, but quite a few of them will actually be put on a virtual ward instead. And I'm pretty confident we'll be the leading provider in Europe for this. We're very well positioned to have that, to make that happen.
Thank you. And we actually have a question in the chat for you, because I'm not sure you'll be sticking around for the Q&A at the end. So let's take that one now. So it's, what are your funding models? Are healthcare providers always the payer of your service, or do you work with other partners?
So at the moment, we work with the equivalent of landsting, different types of trusts, etc. But we contract with community services, so community hospitals, distriktsvård. We contract with large acute hospitals and increasingly with other players as well. But it's typically publicly funded.
Thank you. And thank you for sharing all your insights. Erik, Maria, Emma, do you have a question for Dag? It was a really, really great presentation. Maybe all your questions have been answered already.
Right. Thank you very much.
Thank you very much. Thank you for joining us.
Thank you. And next on the agenda is actually flying to Spain. Yes. We have the pleasure to listen to Erik Blomqvist. He's also a senior program manager at Business Sweden in Spain. And can you maybe start by telling us a little bit an overview of the healthcare system in Spain?
Sure, Michaela. Thank you so much for having me, and happy to see you flying in. That's a great day in the background, as you see with this lovely view we have here. Great. So just to go through briefly as a background to the Spanish system, of course, hate to be repetitive, but of course the healthcare system here as well is based on a publicly funded system via tax income. You've got your universal coverage through a national insurance framework. So it's a typical, really European welfare state setup. No differences in that sense. But we'll get on now to, I think, a bit of the idiosyncrasies that make Spain a bit perhaps different than other markets. And I think here the real key concept to understand is the organization, sort of legally, geographically in this market with its 17 autonomous regions. These essentially work as what in Sweden would be landsting, but they're much more autonomous and have much more, can set their own policies and priorities and budgets and so on. There is some, of course, guidance from a national level, from the National Ministry of Health, on minimum reimbursement levels and so on. But really in these regions, you've got your own health ministries, healthcare provider organizations, own priorities. You got your own levels of funding that can vary. They have their own priorities. And some are very leading and advanced in some areas, and others are less so. So it's a really a very much of a varying landscape in that sense, which is really very exciting, but also takes a lot of studying and understanding to approach. I think when I came here, some said that Spain cannot be defined as one market, but as 17 different ones. So it really takes some local knowledge as well to take it on, I think. Of course, Spaniards are, I think, very proud of this public healthcare system. You can get excellent care. And I think we have about, last time I checked, 14 hospitals in the Newsweek 250 worldwide top hospitals ranking. I think a few examples of those are La Paz here in Madrid, Clinic in Barcelona, and Gregorio Marañón, 12 de Octubre. And that are really leading and advanced hospitals, and that we do have some collaboration as well between those hospitals and Sweden. Another idiosyncrasy, I think, when it comes to the Spanish setup is the private side, and here we differ a bit from, I think, France and Italy. I mentioned a few of those hospitals. Those are, of course, public ones. We also have some private ones. I think the Clínica Universidad de Navarra is especially one that stands out a bit on a global scale also. And that really originates from this vibrant private sector in the healthcare provision. And you've got about, I think, 30% of healthcare expenditure is private, and that's private to private. The private sector lives its own life. It's of course there are some exceptions to this rule, where you got some PPP hospitals, you've got some sort of subsidized setups, but those are rare. I mean, we're talking private to private. Private providers are paid out of pocket or by private insurance. So I think about 25% of the population here has a private healthcare insurance, and there's really a tradition to pay for healthcare out of pocket much more than in other parts of Europe. Of course, if you can save money and you don't have to do it, I think every Spaniard would do so. But there's a different tradition around that concept of finding the best doctor, the best provider, and paying if need be. And in that sense, you've got, I think, there's a large sort of framework, there's a large infrastructure here around that private provision. You got Fresenius, for example, they bought the local operator Quirón Salud a few years ago now. You got Vitas, you got H&M Hospitales, Grupo HLA, and so on, as big sort of hospital groups. We also got, I think, leading individual doctors, also very powerful in this market. And in that sense, I think Spain has actually become an attractive destination for international patients. As I said, you've got the private framework, you got the infrastructure to receive these patients, and you can actually get world-class care at quite a reasonable price compared to other countries. I don't know if they've seen a threat or an opportunity, but for example, MD Anderson Cancer Center, their only center outside the United States is located in Spain, in Madrid. So I think that is really a testament to this concept.
Thank you. A really nice overview. And I mean, when you mentioned the Newsweek ranking, that there are a lot of Spanish hospitals there, we of course have to mention that the highest ranking European hospital is the Karolinska Hospital in Sweden. We always have to mention that when we talk about the Newsweek ranking, obviously.
And I sing that gospel here locally as well to get a lot of traction for Sweden and all of that. So I think they're more than aware of that. I repeat that a lot.
Very good.
But of course, with the audience we have today,
I think everyone in the audience know, but we should always, I mean, that's the only way to spread the message, to talk about it constantly. So thank you very much for this. It's really, really interesting to hear. So what about the big current trends, developments? What's going on right now in the Spanish healthcare?
In the 17 different regions.
In the 17 different regions. That's a little bit similar to Sweden. I've heard that about Sweden as well, that we also have 21 different healthcare systems.
But this is an extreme version.
Really. Yeah, I think it's
an extreme version. So if you don't mind, I'll go through all of them. And,
just go through all of them.
No, of course, there's no time for that. I think, I mean, what we're looking at here is essentially the global challenges, or the Western European ones for the big public healthcare systems. The challenges are the same, the ones you mentioned at the beginning: staff shortages, old aging population. All of those drivers are, of course, very much at the forefront here in Spain as well. I think just to look perhaps more specifically here at Spain, two different strands that I'd like to raise. Firstly, on the digital side, of course, that's been mentioned previously in the other countries as well. I think on the back of the COVID-19 pandemic, that really highlighted the strength of a public system, but also very much its weaknesses and structural problems and challenges. So I think now there's a real push to truly digitalize the healthcare system, to put in this transformation in every sense, and sort of innovation, ways of working, the way we deliver healthcare. So there's a real interest. In 2021, the government approved a plan with essentially 4 tenets. That's to build a healthcare data lake, 5P medicine, precision healthcare, digital transformation of the healthcare system, and really to have a crisis response capability. And I think the really urgency is on the of being ready for a new digital age, and that's being done in different facets. You've got the typical telehealth, remote monitoring, healthcare resource management, and that's where these 17 regions come back again to haunt you, because there's a real push now to improve interoperability in Spain between these different regions and between the Ministry of Health, and to set up a truly integrated system in that sense. And I think just anecdotal evidence, a few years ago, it could be difficult for a resident in one region to go to receive emergency care in another region. So, I mean, we're coming from sort of a very separated setup, and now there's an integration in that sense, in a true digital transformation of using all the technology, beautiful technology we have at our hand, to build relationships between citizens and the healthcare systems, and also within the healthcare system itself, and everything that brings along with the electronic health records and so on. And there's actually, I think, an interesting initiative coming out of this, or a solution, Telea, which in the region of Galicia, which is an example of a telehealth and monitoring system that actually the European Commission has highlighted as a best practice example in this sense. And I know there's a lot of interest from other countries, including Sweden, for that system. So that's a really interesting development. So that's on the one hand, on the digital side. The funding here is, of course, large, with all the EU programs similar as to Italy. I think we're talking about upwards towards 2 billion euros in total. So that's on the digital side. The other strand I wanted to mention is on the infrastructure side, on the CapEx, where big programs have been launched to invest in new capital equipment and having those capabilities, much as in Italy, that was mentioned before, that example. And I think also interesting, in Spain, there's a big push now for hospitals also, both on the public and the private side. We will see the creation of new hospitals with a total of 8,000 beds to be built over the coming years. On the private side, we're talking about more clinics, but smaller. On the public side, there will be fewer but bigger ones. And a real interesting example there, I think, La Paz Hospital here in Madrid, that one of the leading hospitals in Spain that will build a new, be renovated, and the space will now be 320,000 square meters, which is a 72% increase. And we're talking about 1,159 beds in total. So it's a really big investment, and that's also happening in other regions, like in Valencia. That's a similar case of a new hospital being built there, starting next year. We also, as I said, all the private groups are expanding at a rapid pace, especially in the big urban centers, with building new clinics and hospitals also. So I think in taking together these two strands, the digital push, the precision medicine push, sort of more research side, together with the infrastructure and the capabilities, really makes now Spain is a really vibrant, really dynamic market, and has a lot of things going on, I think, both on the public side, the private side. And the key here is, of course, as I understanding these players on the public side, the regional actors, knowing them, their priorities, how they work, where would they be investing, and their agenda. And then on the private side, of course, as well, of these larger, even some multinational groups. So an interesting time to be alive, not to say the least. And I think here, as we probably mentioned in the other countries, of course, relationships are really key. I mean, and in order to succeed and as a Swedish company, capture a piece of this pie, and there's a lot of things to do, a lot of interest, and it's just getting down to work. That's key in capturing here and working locally.
Thank you. And I think we'll get into a little bit more about the how we can actually get a piece of the pie, as you said, during the Q&A session. So thank you very much. That was a really good introduction to the Spanish healthcare system and current trends.
Yes.
Should we let in another company? What do you think?
Yes, I think it's perfect timing to let Fredrik Persson from Prostate Genomics in. Hi, Fredrik. Warm welcome.
Hi. Thank you very much.
We would like you to start off by explaining the challenge that Prostate Genomics answers to. What global healthcare challenge is there, and a short pitch of the company?
Jesus Christ, you're asking for a lot, but okay.
No problem for you.
Let me do my very best. First of all, thanks for having me. It's a pleasure to share some thoughts and ideas, perhaps. I hope so. So what we do, first of all, Prostate Genomics is a public listed company since November 2020. So if anyone is interested, it's just to log into prostategenomics.com, where you can find more or less everything about us. So we provide one product, a genetic biomarker, really, to determine if a prostate cancer patient, a diagnosed prostate cancer patient, needs to undergo radical treatment or not. That's the short pitch, as very few patients actually die from prostate cancer, but the absolute majority, they receive radical treatment, surgery. And the problem with radical treatment is the side effects in the forms of impotence and incontinence. So we better structure what patients that needs to go to radical treatment or not. That's the short pitch. I cannot hear you now.
Oh, sorry. Impressive.
No.
You managed.
Yeah, very good.
Thanks.
So obviously, prostate cancer is a global problem. Can you tell us a little bit about your internationalization journey? Why did you decide to branch out of Sweden, and how was that process for you?
Yeah, it's a painful process to start off with, to be honest. And obviously we are a Swedish company, meaning that the Swedish market, the home market, is always of importance, of course. But already from the very beginning, I've been here for 6 years now, we have the internationalization plans in our minds. So one of the first things I had to do was to decide upon what countries should we, in the first stage, introduce ourselves in, or where should we launch, actually. And Spain came up very quickly in that process. So together with Italy, Germany, and UK, when it comes to Europe. So those are the 5 countries, including Sweden then, where we are present. And we have also started off in the US. And you are perfectly right that prostate cancer is actually the most common form of cancer in the Western world among men. And that includes Spain, actually. So Spain was very early, as I mentioned, a target market for us. And I think many of people listening here are aware of the fact that I mean, to do the analysis is not so difficult. The problems starts to occur when you actually are about to enter a market. From my understanding in this meeting, there are larger companies and there are smaller companies. And of course, we are a small company. Usually you have in-house expertise or experience from most markets, but definitely not all. And as Eric touched upon here, if I understood things correctly, I mean, things are changing so quickly that information-based, or if you receive information that was based on experiences 3 or 5 years ago, that's already outdated. So, and we hit some hurdles, not only in Spain initially, but also in the other countries where we thought we had updated information, and we had embryos of action plans that turned out not to be that accurate, actually. So that's how we came in touch with Business Sweden, actually.
Have you had support in this painful process from Business Sweden?
Yes.
Can you describe a little bit what type of support you received?
Yeah. Well, I've had the pleasure of working with Business Sweden when it comes to several countries, and Spain was the first country where we actually worked together, and as many of us do, we use consultants in our daily life or external companies to help you to continue to develop the company. Of course, we had contacts also with other other alternatives to Business Sweden. But in the end, the decision was pretty easy to go with Business Sweden. Apart from Spain, we have also had partnerships or cooperated when it comes to the Chinese market and the French market. Quite quickly, it became very clear from my point of view that this is actually what I'm looking for very often, but don't face too often, if I put it in that way. We had a very, very productive partnership with Business Sweden, starting off in Spain. The meetings that were arranged by Business Sweden, the contacts, the doors that opened up, not only with clinics, but also with individual KOLs, which in our case is very, very important, and other key people. So I can only say, and it sounds perhaps like I'm employed by Business Sweden, but I'm not. I have very positive experiences from Business Sweden, not only in Spain, but also in China, where I have been involved a little bit more in that process. And I think the difference I experience with Business Sweden is that, I mean, compared to private or other forms of companies that provides about the similar services, I think it's extremely honest. And apart from the level of professionalism, the outcomes when you are to decide or to discuss with your partner, in this case, Business Sweden. There is no, what should I say? How should I put this now then? Actually, what you do get is the true picture, the full picture. Like in China, for example, Business Sweden told me that, okay, Fredrik, this is how it looks like, and we propose that you wait 5 years. Okay, that's maybe not what I wanted to hear, but it's the truth. And that makes it I mean, we're a small company, we have limited resources, but it made our decision to wait with China, of course, a lot easier, because we need a lot of resources in other countries. So I think the whole package provided by Business Sweden in these countries where we have cooperated has been absolutely excellent. And I'm not employed by Business Sweden. Let me just underline that again.
Thank you. That's great to hear. I mean, it really, I think, warms all of our hearts that for all this positive feedback. And it is, as you said, I think it's very good that you brought that up. When small companies are expanding internationally, it is also important to know which markets to not enter. So thank you very much for that, and thank you, Fredrik, for this. I think it's time to move into the Q&A session. Again, we do have a chat. We have a lot of questions in the chat, but there's still room for more, so please keep entering the questions in the chat. And maybe, Michaela, do you want to start us off?
Yes. So I would start by asking Maria in Italy. Do you have any advice to companies going to your market?
Yes, definitely. Just want to say it was really interesting to hear all of the other speakers. I'm so happy to hear such positive feedback for my colleagues. It really makes me happy. But yeah, advice for Swedish companies interested in the Italian market. So it always helps to partner up in Italy. If, for instance, you're in the telemedicine business, then there are a few really big and well-established telemedicine providers operating in Italy right now. And they are looking for collaborations, for instance. So that could be one option, one way of entering the market and doing so more quickly. Because if you're not ready to establish yourself yet, of course, as we heard, funds are scarce for maybe small, medium-sized companies. So before creating a local establishment, having a local partner is a way forward. And they can also support Swedish companies in public tenders, for instance, which can be quite complex processes. So that is quite a convenient way to enter the market. But also, you could start by avoiding the public healthcare sector in the beginning and maybe going more towards the private one if you want a bit of a quicker way to start working with customers and you avoid the public tenders. But I would definitely suggest that you consider also the public healthcare system eventually, because that is where the main business lies in Italy. And also another important thing for Swedish companies is that there are a lot of regions, clusters, and areas that are typical for a certain sector within the healthcare sector. So it is important to be part of these networks. It can be industry clusters, university areas, other types of associations. So being part of that and creating a network locally also helps a lot to do business here. And I would say I would begin with that.
And then may I just jump in and ask, since there's a lot of EU money being spent on rebuilding the healthcare system in Italy, would you say that the Swedish companies can be competitive in the procurements, or is there anything specific to keep in mind in regards to that?
I mean, for sure, there is a certain price pressure in Italy. I'm not going to lie about that. But yes, I mean, Swedish companies, there are quite a few that are already present in Italy and are very well established here and are also well known in the industry for the quality of their products, for sustainability, for innovation. And they do win very big tenders. We have one Swedish healthcare company. They won the biggest tender in the history of the company globally in Italy, for instance. So there are definitely ways for Swedish companies to be part of these tenders. And the EU money is definitely very relevant. Perhaps not all companies will be able to win tenders directly, but rather as maybe subcontracts to the big tenders, because it's more the hospitals making the investments or the regions, for instance. So it depends a little bit where in the value chain you come in. But for sure, yes, this EU money is relevant for Swedish companies.
Thank you. We also have a follow-up question to Maria directly. So, as a part of the telemedicine strategy that you mentioned, is there a drive to accelerate bench to bedside treatment as a part of this?
Yeah, I read the question, and I will also ask to be able to follow up on that separately and after this webinar. I'm not 100% sure, but I do know, and for instance, Business Sweden is collaborating with the National Institute for Health here in Italy, and one of their main projects within telemedicine is actually decentralized clinical trials, so doing research within the pharmaceutical industry, and that is supported by telemedicine. I don't know if that is directly related, but there are initiatives in research within clinical trials and telemedicine, but I would need to look further into that specific question. So, but I'm hoping yes, because it sounds like you would be interested in the Italian market then. So, but I will get back to you.
And that sounds also the decentralized clinical trials is obviously an area that's growing in Sweden. So there might actually be some collaborations there, possibly.
Would be great. Can we move to France?
Yes.
And look on the advice to companies interested in entering the market?
Yeah, absolutely. I mean, of course, I agree with a lot of what Maria said. A lot of it applies in France as well, of course. I would like to highlight the fact that, I mean, we are talking about fast tracking reimbursement for remote monitoring and that sort of thing. But I think that it's important to take a sort of a wider look at the system, because if you look at products that are not fast tracked, which are also a lot of products that don't fall into this category, it is important to highlight that getting your product into the reimbursement system and starting to sell properly to the system takes a long time. So an advice would be to get the process started early, and also make sure that you get, that you're up for the marathon that it is. It's not necessarily a sprint. That said, it's also important to add maybe that the adoption of new methods and technologies, or even just new manufacturer suppliers, requires proper anchoring also in the system. I don't know how specific to France this is, but this is something that we see a lot in our day-to-day work. So I think it's important to mention. So whereas international clinical studies are often well regarded and used, one should also expect to need to perform local French studies as well in many areas. And for this, of course, you really need to understand the system and its different decision makers, get to know the right key opinion leaders, get on their agenda, understand what's important to them in order for them to be your champions, because they really have to do that here. You need them here. And once you're in, you're obviously reaching a massive European market, and then the upside is big. Another shorter advice or just reminder is also that you shouldn't expect a market for out-of-pocket spending in France. Of course, there are exceptions, but it's important to highlight. Like I mentioned, the French are not used to paying for care.
Thank you, Emma. And with that said, you mentioned the 95% having the additional insurance. I got a little curious myself. So you mentioned pharmaceuticals being covered in that as well. So is there still a small fee for the private person to pay, or is it totally funded by the?
Yes, there's always when it comes to care, there's always ticket moderator. So there's always a small part that the patient pays, but it's like, for example, for an emergency room visit, it's 19 point something euros. So it's similar, I think, to other markets. And when it's a very good question, because when you look at medication, for example, it of course depends on the reimbursement level or the level of coverage for each particular type of medicine, if it's considered the importance that it has attributed to it, and so on. There will probably be a bit, but usually very little. And like you said, a lot of the costs that are not covered by the universal health insurance are often covered by the complementary insurance. So the out-of-pocket or the remaining charge for the patient is really low, if any.
Thank you. So we got a question here in the chat. So are the mutual funds driving any change to the funding in the healthcare market? Are they a way to enter the market?
They're very important, absolutely. We can also see that, for example, in the case for telemedicine, they have, for example, their own solutions that they're implementing, or there have been quite a lot of cases where they've acquired that type of solutions into their own activities. Many of them actually run primary care services, like physical primary care services. So this is an interesting complement to that. They are, of course, also very interested in prevention in order to keep future costs down, and that's something that they're focusing on a lot. So if you can contribute to that business case, I would say that it's very interesting. That said, they are closely intertwined with the universal health insurance. So in general, for something to be reimbursed by the complementary health insurance, it also needs to be included in the universal system, with the exceptions of dental and eyes. But still, it's important to remember that it's not enough usually just to go through them. You have to do a double approach.
Great. Then not to forget Spain. Eric, do you have any advice on companies entering your market?
Has been said by my colleagues here previously. Understand the local conditions first and foremost, and also work locally. And this is, relationships are so important here. So speaking with, getting to know the customers, the purchasing organization, working with the right distributors, working with the right partners, that's really key. And I mean, I have some Swedish companies who've told me, I mean, our strategy will be to try to win a couple of tenders and then enter the market. I think that's a way not to enter the market, because not going to happen. Like, you're not going to win public tenders, or the chance is very low, unless you have been there, present physically, shown interest, getting to know the purchasing organization, the local ecosystem. You're not going to get businesses unless you're here, present in some way or another.
Thank you. We actually got a very specific question on that. So, is there a history, or is there any chance to win a tender if you're not Spanish, Italian, or a French company? Emma, do you want to go first?
I can't say anything about the success rates, but I can say that most of the Swedish companies that I interact with that are doing business with the French system have local subsidiary. I'd be happy to discuss this more in detail for each individual case, but just some anecdotic / statistics.
Maria, what about Italy?
I mean, yes, the Swedish companies win tenders here all the time, and Swedish companies are quite successful in Italy in the healthcare sector. And I think it's not so important to be an Italian company in Italy, but it's important to speak Italian, be present locally, or have an Italian partner. Then it doesn't matter where the technology comes from. So it doesn't, you don't have to be an Italian company, but you have to be like an Italian company, if that answers the question.
And what about you, Eric? It didn't sound too optimistic in your first, but maybe you want to accentuate that.
Yeah, but I can add some flavor to that. Completely the same as Maria and Emma just said. You can absolutely win business, but you do that if you're here, you have the local subsidiary in place, you're here, you have a person here locally or a team, or, I mean, there are some of our clients and Swedish companies who win deals here have been here for 50, 60, 75 plus years and so on. So absolutely they win business, a lot of business. But of course they do that by being here present. They don't do that by doing business remotely from Sweden, or you can do that, as I said, through your local partners, your distributors, and so on. And I'd also add to what has been said is that it's important to understand that actually Sweden and Swedish technology is highly regarded. I mean, it's seen as such a forefront example that a lot of doors open and a lot of opportunities come up just by being from Sweden and Swedish and what Swedish healthcare represents. Now, we perhaps don't tell the entire story of that we also have waiting times in the Swedish healthcare system and so on. But there's a lot of people appreciate a lot they view it as a world-class example, and anything that you can label or brand as Swedish innovation will garner a lot of interest. It will open doors.
And that's great to hear.
Yes.
I mean, Sweden is a well-known life science nation, and it's very, very nice to hear that also applies to your markets. So we did get a question on how digitalized the hospitals are in your respective countries. Like, how far is the digitalization of healthcare in the hospitals? Like, what's the development of that? Eric, would you like to start?
Yes, thank you. I mean, digitalization part, I think you have some of the most advanced examples. So I think Spain is always is a country of contrasts. So you would have some of the perhaps most advanced technology in some hospitals. As I mentioned, some of the leading hospitals, and definitely there would be high degree of digitalization. In other hospitals, perhaps much more less. I think you're talking about a wide spectrum of maturity in that sense. But there's as I said, there's a big push to drive that digitalization further. That is, yes, to some extent in specialized care, like in hospitals, but also very much in the primary care setting, where perhaps we're lagging behind other front runners.
And Maria?
Yeah, I can really agree with what Erik is saying, that you will have, it's the same, the most advanced examples also in Italy, and then you will have regions and hospitals and healthcare providers that are using paper 100%, more or less. So it's a bit hard to answer the question on a general level in Italy, but also here we can see a big push towards becoming more digital. I think one main challenge here is maybe single healthcare providers can be quite digital, but there's definitely a challenge when it comes to data sharing and interoperability and these types of issues. So I mean, there are limits then to how digital you can be if you don't communicate with others. I'd say that's true for Italy.
So thank you very much. Emma, did you have anything to say in this regards?
Well, I do agree, of course. And I think that, I mean, there are, of course, still extreme cases where you carry around your own medical journal to all of your different doctor's appointments, and that happens also in the most well-renowned hospitals. But this is where things are changing rapidly now. And one of the main challenges is probably not how digital the actual hospitals are, but how well they communicate with other types of care, like primary care, and how connected they are. So the interoperability aspect of it is very, is being addressed now. So and hopefully resolved.
And we got not as much the question, I think it's more of a comment. I believe it had to do with the discussions on the tenders, that it is important to choose a really good distribution partner and to talk to customers in the region to see which partners they are using and to find a good distribution partner. And I know that this is something that you help companies with, or the Business Sweden helps companies with across the world. And it's a really good point to bring up, because choosing a good partner is of course essential. Any comments from either of you here, or maybe from the company side?
I agree.
Yeah, good. Everyone agrees. That's perfect.
And then moving on, you've fed us with a lot of interesting information. We now have thousands of questions, and a couple of questions that we will actually forward to you that you can answer to separately. But on the topic of next step, what do you have any activities where you will invite companies in the healthcare field in the future for people to, sign up for? Should we start with Emma?
Sure. Yes, absolutely. We often have things planned. I mean, we work mainly on an individual basis, such as it's been described before, but with companies. But we also see that, especially in the healthcare sector, there's also an importance of like lifting the discussion regularly with higher level stakeholders, higher level decision makers, including policymakers in the discussion, and sort of positioning Swedish companies as solver of problems, and not only talking on the purchasing level or the hospital level. So we do this regularly, and then we usually do it with a group of Swedish companies. We have one high-level seminar coming up, actually. It's focusing on French-Swedish cooperation for resilient healthcare systems, and it's going to take place in September. So we're basically gathering a group of policymakers and other decision makers from the French and Swedish systems, for example, the respective e-health agencies. The French one is really a key one for Swedish companies entering the French market in the digital field, of course, especially for the remote monitoring legislation that we just talked about. But this is basically where you get your solution referenced. So it's important to have a relationship with them and know about them. So we're organizing this together with the embassy, of course, and about 7 or 8 in discussion with the 8th one currently, Swedish companies. So it's both subsidiaries, so Swedish companies that are already present here, who have been here longer than I have, but also smaller players that are not yet present in France, but are interested in these topics. So please reach out if you would like to know more, or if you're interested in participating, and I'll be happy to share the details.
Maria, on your end.
Yes, well, we work definitely in a similar way as the French office, and currently we are collaborating. I think I mentioned it, the Institute for Health, the National Institute for Health here in Italy, Istituto Superiore di Sanità, and the collaboration began a while back, more as an interaction between Business Sweden and the Institute to see what possibilities there are for collaborations. But recently, the director for telemedicine of the Institute was with us in Sweden at Vitalis, actually, and was a speaker at Vitalis, where Britta moderated. And he also had quite a few interesting meetings during those days in Göteborg with several Swedish stakeholders and companies. And we have now some quite concrete ideas on how we can move forward and collaborate. And there is an idea to put together a group of Swedish companies, stakeholders, and the Italian Institute within primarily connected health, so still quite broad, but there are things we can do together. So if you want to know more, this would be a really good opportunity for Swedish companies to position themselves towards key decision makers in Italy. So I'd be happy to discuss that further with Swedish companies.
Great, thank you. It was really nice to have him at Vitalis and to showcase the Swedish digital healthcare system. It was really great. So last but not least, Eric, what's going on in Spain?
Thank you. Yes, a lot. I mean, we're, as all the other countries, we work a lot with individually with Swedish companies. We also provide these kind of platforms to position the Swedish healthcare industry, and in that sense, this year we're working together with the World Health Organization and the Spanish Ministry of Health and the regions, and with Sweden around the concept of digital health and remote monitoring and so on. So that will be is taking up a lot of our time currently, and this is of course something big that we are working with and organizing within that framework.
Thank you. And as we said, there are a lot of questions in the chat. We won't have time to answer all of them, and the more specific ones we will forward to the respective colleagues, and you will receive an answer to them.
Yes. Okay, so we're basically at the end of the event, and we've kept time so far. We're proud.
Very proud.
Any thoughts from your end, Britta, on...
Well, I think it's been a really great session. We really appreciate all the questions and the discussions. And if you're interested in internationalization, don't hesitate to reach out to Business Sweden, to any one of us. Then we'll guide you to the right person. It is the interest for Swedish companies and Swedish solutions is huge. There's a huge global and European demand. So don't hesitate to reach out to us.
May I also add something? One of my warmest recommendations usually is for companies to try to find a company that's done the journey that they are looking into. So take the opportunity. If you feel like Fredrik or Dag have done a journey that you're facing or about to face, I think it's sometimes in that kind of connection that you can really learn and, learn from each other. It's not giving away free time with Fredrik and Dag, sorry. But that's a warm recommendation to learn from each other.
Yeah, definitely. And also, I mean, since Business Sweden is a semi-governmental organization, we have a governmental assignment to help small and medium-sized companies in their global journey. So we have free of charge or subsidized services that are available for companies looking to expand internationally. Any last words from our panel?
Thank you so much for having us. Been a real pleasure to talk more about our markets and really last word of encouragement as well. I mean, we have a lot of expertise, a lot of know-how in Sweden, a lot of interesting solutions and products and ways of working, innovations. Keep the Swedish flag high. There's a lot of interest. That flag can open a lot of doors. There's a lot of interest for what's going on in Sweden. It's seen as I said, as a front-running example, world class, that I think people in Southern Europe want to copy. So I think all the possibilities are available.
Great.
Yeah, I can only agree, and we look forward to following up with the companies that participated today afterwards to set up meetings and discuss further.
Great. Well, thanks everyone for listening and for asking questions and keeping the debate alive. And thank you to Dag and Fredrik, obviously, for sharing your insights. It's always good, as Michaela said, to hear from another company and who's actually done the journey. And thank you for coming here to our studio at Business Sweden.
Thank you, Britta, for having me. It's been a pleasure. All right, so thank you everyone, and looking forward to see you again.
Yeah.
Bra jobbat!
Mycket jobbat.
Nej.